Have you ever pondered over the complexities and challenges of managing difficult airway scenarios? Let's delve into the world of difficult airway scenarios, a realm that is as complex as it is crucial to understand, especially for healthcare professionals. But what exactly does this term mean? Simply put, a difficult airway scenario is a situation in which a clinically trained individual has trouble securing a patient's airway. This could be due to a variety of factors, such as anatomical variations, disease states, or trauma. These scenarios can pose significant challenges. They require quick thinking, a comprehensive understanding of the human anatomy, and a high level of skill in airway management techniques. The stakes are high, as a failure to effectively manage a difficult airway can lead to severe consequences, including hypoxia, brain damage, or even loss of life. So, why is it so important to understand these scenarios? The answer lies in the unpredictability of medical emergencies. They can occur anytime, anywhere, and to anyone. Therefore, healthcare professionals must be prepared to handle these situations efficiently and effectively. Moreover, understanding difficult airway scenarios also helps in planning and implementing strategies to prevent complications. It allows healthcare professionals to anticipate potential problems and devise a suitable plan of action. It's like playing chess, where one must always think several steps ahead to ensure the best possible outcome. However, it's not just about the healthcare professionals. Understanding these scenarios can also empower patients and their loved ones. It can provide them with insights into the potential challenges and risks involved in medical procedures, enabling them to make better informed decisions about their healthcare. In essence, the realm of difficult airway scenarios is a complex puzzle, laden with challenges and intricacies. But with knowledge and understanding, it's a puzzle that can be solved, a challenge that can be overcome. So, join us as we dive deeper into this fascinating topic, exploring the causes, symptoms, and management strategies for difficult airway scenarios. And so, understanding the difficult airway is not only critical, but can be life-saving in many scenarios. So, what exactly is a difficult airway, you might ask? Well, let's dive right into it. A difficult airway is a clinical situation where a conventionally trained healthcare professional encounters difficulty with face mask ventilation of the upper airway, difficulty with tracheal intubation, or both. Now you might be wondering, why does it matter? Well, the respiratory system, as we know, is a critical component of our body. It's responsible for delivering oxygen to our cells and removing carbon dioxide. In essence, it helps us breathe and ultimately stay alive. When an individual's airway is compromised, it can severely affect this vital gas exchange process. Picture this. You're driving a car, and suddenly the road ahead becomes foggy. The visibility drops, and you struggle to navigate your way forward. A difficult airway situation is somewhat similar. It makes the otherwise smooth road of air passage unclear and challenging to navigate, making it harder for the body to receive the oxygen it needs. Now let's talk about why understanding the concept of a difficult airway is crucial in medical procedures. In many scenarios, healthcare professionals need to secure an airway for a patient. This could be for surgeries under general anesthesia, for patients in critical care, or even in emergency situations. When faced with a difficult airway, these routine processes can quickly escalate into life-threatening situations. It's like trying to drive through that foggy road without proper headlights. The stakes are high, and the margin for error is minimal. So, understanding and identifying a difficult airway is of paramount importance for healthcare professionals. It allows them to be prepared, to have the right tools at hand, and most importantly, to take the appropriate steps to ensure the patient's safety. Thus, a difficult airway presents a challenge to healthcare professionals, requiring immediate and efficient management. One may wonder, what leads to a difficult airway? It's a valid question, and the answer is, well, multifaceted. Let's delve into the various causes that can make airway management a tricky business. Firstly, anatomical anomalies can create unexpected challenges. Each person is unique, and so is their airway. Some people naturally have narrow or short airways, while others may have a large tongue or a high-arched palate. These characteristics, while not problematic in everyday life, can make intubation or the insertion of breathing tubes particularly challenging during medical procedures. Obesity is another factor that can complicate airway management. Excess weight can cause changes in the structure and function of the respiratory system. It can lead to fat deposits in the neck and throat, narrowing the airway and making it more difficult to secure. We also can't overlook the role of trauma. accidents, burns, or injuries can cause swelling, bleeding, or damage to the airway, making it difficult to maintain a clear passage for breathing. In such cases, airway management becomes a vital and often urgent part of patient care. Then, there are medical conditions that can lead to a difficult airway. For instance, tumors in or near the airway can obstruct airflow and complicate intubation. Similarly, infections in the throat or neck can cause swelling and inflammation, narrowing the airway and making it harder for healthcare providers to ensure clear and unobstructed breathing. It's also worth noting that age can play a role in airway difficulty. As we age, our tissues lose elasticity, which can lead to changes in the shape and function of the airway. In some, a difficult airway can be caused by a wide array of factors, from individual anatomy and body composition to trauma and medical conditions. These complexities underline the importance of comprehensive assessment and tailored approaches when it comes to airway management. As we can see, a range of factors can lead to a difficult airway, making it a common challenge in healthcare. Now let's uncover the signs that indicate a difficult airway. One of the most common symptoms of a difficult airway is snoring. This isn't just your run-of-the-mill, sawing logs kind of snoring. We're talking about loud, persistent snoring that seems to rattle the rafters. It might seem like a mere annoyance, especially for those who share a room with the snorer, but it can be a clear indication of a difficult airway. Next up, we have sleep apnea. This is a condition where breathing repeatedly stops and starts during sleep. It's like the body forgets to breathe, causing the person to wake up gasping for air. It's a bit like trying to catch your breath after running a marathon, except you're not running, you're sleeping, or at least you're trying to. Then there's difficulty in breathing. This is a broad symptom and it can manifest in a variety of ways. It could be shortness of breath, where it feels like you can't get enough air into your lungs. Or it could be stridor, a high-pitched wheezing sound that's caused by disrupted airflow. It's not exactly a symphony for the ears, but it is a telltale sign of a difficult airway. Finally, let's talk about changes in voice. This could range from hoarseness, where your voice sounds breathy, raspy, or strained, to dysphonia, a condition where the voice sounds different in pitch or volume. Imagine being at a rock concert and trying to talk over the music. That's what it can feel like. Keep in mind, these symptoms aren't exclusive to a difficult airway. They could be indicative of other health conditions as well. But if you or someone you know is experiencing these symptoms, it's important to seek medical attention. Because, as the old saying goes, it's better to be safe than sorry. Recognizing these symptoms early can aid in timely intervention and better management of a difficult airway. Management of a difficult airway requires a strategic approach. You see, managing a difficult airway isn't simply a matter of applying a one-size-fits-all solution. It's about understanding the unique challenges each situation presents and tailoring your approach accordingly. Let's dive into some of the strategies that can make a world of difference. First off, preparation is key. This includes not only having the right tools at your disposal, but also having a well-thought-out plan in place. This could mean establishing a clear line of communication with your team, ensuring everyone is on the same page, or having backup plans ready in case your initial strategy doesn't pan out. Speaking of tools, there's a vast array we can employ to manage a difficult airway. From laryngoscopes and video laryngoscopes to supraglottic airway devices, each tool has its own strengths and limitations. The trick is to understand when and how to use them most effectively. Now let's talk techniques. Techniques such as optimal positioning, the use of neuromuscular blocking agents, and even surgical methods like cricothyroidotomy can be life-saving in a difficult airway scenario. But remember, these techniques require skill and practice. Regular training and simulation exercises are crucial to keep your skills sharp and ready for when you need them most. Of course, managing a difficult airway isn't just about the physical aspects. It's also about maintaining a calm and composed demeanor, even when faced with challenging situations. This not only helps you think clearly, but also fosters a sense of trust and confidence among your team members and patients. Lastly, let's not forget the importance of post-management care. This involves monitoring the patient closely for any complications and providing appropriate follow-up care. It's this comprehensive approach that can significantly enhance patient outcomes. In conclusion, managing a difficult airway is a complex task that requires strategic thinking, technical skills, and emotional resilience. Effective management of a difficult airway can significantly improve patient outcomes and reduce complications. So, equip yourself with the right tools, techniques, and mindset, and you'll be well prepared to handle whatever comes your way. Time to recap what we've learned about difficult airways today. From the get-go, we jumped straight into the definition of a difficult airway. It's a clinical situation where a conventionally trained anesthesiologist experiences trouble with face mask ventilation of the upper airway, difficulty with tracheal intubation, or both. We then shifted gears and delved into the causes of a difficult airway. It's important to remember that this condition can be brought about by a myriad of factors. These can range from anatomical anomalies like congenital syndromes and trauma, to physiological issues such as obesity and pregnancy. A difficult airway can also be the result of pathological conditions, including tumors, infections, and airway obstruction. Next, we touched upon the symptoms of a difficult airway. We learned that these can be as varied as the causes. They might manifest as difficulty in breathing, changes in voice, or even shortness of breath. In some cases, these symptoms might not be present until an attempt at intubation is made. After that, we dove into the strategies for managing a difficult airway. We learned that it's all about being prepared and having a plan. This includes having a broad understanding of the patient's airway anatomy, being familiar with various airway devices, having a systematic approach to airway assessment, and knowing when to call for help. Furthermore, we highlighted the importance of regularly practicing airway management skills and staying updated with the latest techniques and guidelines. Throughout this journey, we've learned that the recognition of a difficult airway is the first and most crucial step in managing it. Early recognition can lead to better preparation, more successful outcomes, and ultimately, improved patient safety. Remember, understanding and managing a difficult airway can be challenging, but with knowledge and preparation, it's a challenge that healthcare professionals can overcome. So, why is understanding the difficult airway so crucial? Well, as we've journeyed through this topic, it's clear that this isn't a question of mere technicality. It's about the very essence of healthcare, patient well-being. Understanding and managing a difficult airway is like holding a key to a myriad of complex health scenarios. It's about being prepared to navigate through unexpected turns, about being versatile in your approach. It's about not only recognizing but also responding effectively to signs of distress, thereby mitigating potential risks. When we better comprehend the difficult airway, we empower ourselves to provide more tailored and effective care. It's like sharpening our tools before diving into a task. The more prepared we are, the better the outcomes we can expect. In the end, the goal is to ensure the best possible care for patients, and understanding the difficult airway plays a pivotal role in achieving that goal.